Welcome everyone. This is Dr. Devin Coughlin with Revolution Health Center, and I want to take a couple minutes to talk about heart disease today and the impact that cholesterol has on heart disease. So we've all been taught for a long time that the reason we get heart attacks and heart disease in general is because cholesterol builds up in our arteries and clogs them. So you've all heard that before. And what I want to talk to you about today is new research coming out of Japan. These Japanese researchers are actually having a different theory. Their theory is actually that statin drugs, cholesterol-lowering drugs, are actually stimulating atherosclerosis and heart failure. And so let's talk about that for a second. So we've always been told that cholesterol builds up and clogs our arteries, but the question we have to ask is, in America, we have on average the lowest cholesterol in the entire world because everyone's taking drugs. We take more statin drugs than any other country in the world. We have the lowest average cholesterol. Yet there's an inverse relationship there. So the more cholesterol drugs we take, we lower our cholesterol, our heart disease and heart attacks are actually going up. And so there's this inverse proportion of lower cholesterol and higher heart disease and heart attacks. Whereas if you look in Europe, like in places like Spain and France and Italy, on average, they have much higher cholesterol than we do and much lower heart disease. And so let's talk about some impacts here of what the researchers are saying about the statin drugs and how they're damaging our bodies and causing atherosclerosis. So think about it. Circulating cholesterol in our body is what the statin drugs actually are going after. And so when you get your blood measured, they're measuring how much cholesterol is circulating in your bloodstream. That does not necessarily mean how much is being laid down in the arteries as far as plaquing goes. So you can lower your cholesterol all you want, or you can have low cholesterol or high cholesterol. If it's not being laid down and plaquing the arteries, it's a non-issue. And what they're saying in this article is that statins are actually causing more plaquing, more atherosclerosis for a couple of reasons. And the first reason I'm going to talk to you about is the mitochondria. So a lot of people know that mitochondria is what actually powers cells and creates energy in cells. And what happens with these is that the statin drugs are impairing muscle function because what they do is they actually impair the mitochondria and its ability to make ATP. So ATP is what gives our cells energy to work, and statin drugs are destroying our cells' ability to make ATP. So there's another problem that statin drugs cause long-term in the body is something called rhabdomyolysis, which is damaging or wasting away of muscle tissue. So not only is it actually impairing how much energy our cells can make, it's destroying the muscle tissue as well. A number of other facts and other parts they talk about here is that it impairs all the muscles in the body, mainly the heart, which is obviously a muscle, the blood vessels, which are considered smooth muscles, they get damaged in the process of cholesterol drugs. And the reason why is because cholesterol drugs deplete our body's production of coenzyme Q10, which a lot of people are aware of. They take that supplement if they're on statin drugs. And you also see this compound called heme A decreases as well. Again, those two reasons are what causes ATP to go down. Another thing that the researchers pointed out was that statin drugs inhibit the synthesis of vitamin K2, selenium, and glutathione. Really, really important nutrients, especially glutathione being the #1 detoxifying hormone in the body, is damaged by cholesterol drugs. Also, libido is lowered. People have liver disease and kidney problems from this long term. So what we're finding is, in addition to all the side effects that are well known, well documented, these researchers are actually saying that this is, these statin drugs are actually promoting congestive heart failure as being the other impact of as far as increasing heart disease. So the other article I want to talk to you today about is this article that came out of another journal talking about C-reactive protein. So C-reactive proteins, also called CRP, is one of the cheapest and best ways to measure our real risk, true risk of heart attacks and cardiovascular problems, because CRP is the best way to measure something called systemic inflammation. So again, cardiologists and our doctors and people for decades now are focusing on cholesterol, but cholesterol is not the problem. Like I mentioned before, if you look in Europe, people have higher cholesterol, but they have much lower rates of heart disease. And so in this article, they actually talk about CRP measuring systemic inflammation, which is the #1 predictor, not just of heart disease, but of all disease. Inflammation now is well known to be a major, major predictor of disease. And so when we look at some of these other things, actually in the article they talk about 50% of heart attacks in America right now are happening in people that have average to low cholesterol, meaning more than likely they're on statin drugs, which obviously has a problem like we mentioned before in the other article, but they have average to low cholesterol. And so again, what we're led to believe is that low cholesterol equals you're reducing your risk of heart attacks, but 50% of people, so 1 in 2 have low cholesterol that are having heart attacks. So we know that's false. We know that's not true. The whole process of the plaque being formed in our arteries is our body's way of trying to heal. So when that inflammation creates damage and scarring and cutting of the wall of the artery, our body goes in and it lays down cholesterol to try to heal that, just like patching a road. Like if you have a pothole in the road, like a tear, and you go and you lay down something to patch that, that's what the cholesterol is doing in your body. It's a healing mechanism. So when people are taking statin drugs and they're lowering their cholesterol, they're actually impacting and impairing their way their body can normally heal properly. So two major things to understand here is that if you're focused on preventing heart disease, stop focusing on the cholesterol, start looking at the CRP or the C-reactive protein, because inflammation is a much better predictor than having high cholesterol, right? So if you're on statin drugs or cholesterol-lowering drugs, you need to seriously reevaluate that and start looking more at your diet, exercise, and whatever supplements you may need to get your inflammation down and not so focused on the cholesterol levels themselves. It's been Dr. Devin Coughlin with Revolution Health Center. Make sure you follow us on Facebook, Revolution Health Center. You can also go to our website, revolutionhealthctr.com, and get these videos and more upcoming information that we have for you.